next? Okay, the maxilla. The maxilla is the upper jaw. And the first thing we've asked you to find is the infraorbital foramen of the maxilla. It's labeled M1 on the anterior view. So here's the anterior view. There is a pair of holes or openings right below the eye sockets. So since the eye sockets are called orbital, this is called the infraorbital foramen. Infra means below the orbit. Infraorbital foramen, again, it's for blood vessels and nerves. All right, and then we mentioned the teeth again. So again, that's absolutely identical to the mandible. We've asked you to know the medial and lateral incisor and the canine in each quadrant. The zygomatic process of the maxilla. The zygomatic process of the maxilla is where the maxilla attaches to the zygomatic bone. That's M2. Here you can see M2. So this is the maxilla. Here's where it attaches to the zygomatic. Zygomatic attaches to the maxilla. So this is the zygomatic process of the maxilla. This is the maxillary process of the zygomatic. It's just a matter of which side of this suture line are we looking at. The frontal process of the maxilla. It's labeled M3. We spoke of it earlier. Here's where the maxilla attaches to the frontal bone, right here on the medial side of the eye socket. And so this would be the frontal process of the maxilla, and right above the suture line is the maxillary process of the frontal bone. All right, and then the next term, palatine process of the maxilla. This is where the maxilla attaches to the palatine bone. If you would look on your lab manual on figure 9.2, this is an inferior view. It says that, inferior. You're looking at the skull from the underside. This is the palate, or roof of the mouth. And in purple, this is the maxilla. And in putty, I don't know what color that is, but I don't know, this color right here, this light brown, that's the palatine bone. It says that right here. So this, since there's a lot of maxilla, this is called the palatine process of the maxilla. It says that right here. And this is the palatine bone. You'll notice there's a suture line right between them. So you can see this when you look at the skull, right, the inferior view. You can see this suture line between the palatine process of the maxilla and the palatine bone. Now, since we're looking here, you'll notice there's a hole, an opening right here behind the incisor teeth. There's a hole right here behind the incisors, and that's called the incisive foramen, where blood vessels and nerves go. And it's in your lab manual, they call it the incisive fossa. All right, so there's an example where I'd have to accept either incisive fossa, which is what your lab manual says, or incisive foramen, which is what I said. Either term would be fine. I said foramen because that's a hole, so it's the easier. The roof of the mouth is actually formed by 3 bones. The palatine process of the maxilla, the palatine bone, and this purple right here is the sphenoid bone. And this area, there's kind of some rough edges right here. That's called the pterygoid process of the sphenoid bone. So that forms the posterior part of the palate. On your skull, so this is the palatine process of the maxilla. Here's a suture line. This is the palatine bone. And these rough edges right here and here, this is the pterygoid process of the sphenoid bone. In our Mr. Skullhead pictures, on the inferior view, page 3 of the Mr. Skullhead picture, it's labeled S9. S9, the pterygoid process of the sphenoid. We haven't gotten to the sphenoid yet, but I'm just mentioning it now. Now, we have mentioned on the bottom, on our 22-page handout, page 4, we have spoken of the incisive foramen. And on the top of page 5, the maxillary sinus. Now, we have mentioned that there are sinus cavities in our bones of our skull. And the only way to see these hollow cavities in the middle of a bone is with an X-ray. And on section E, page E4, you'll remember we mentioned this previously, there are these hollow cavities in 4 bones. These are known as the 4 paranasal sinus cavities. There's a frontal paranasal sinus cavity. We mentioned this when we were talking about the frontal bone. There's an ethmoidal, a sphenoidal, and right now we're talking about the maxillary. Now again, this is a hollow cavity in the bones. You cannot see this in looking at a skull because it means it's hollow on the middle of the bone. So the only way you can see it is if you have X-ray vision. Since you don't have X-ray vision, we have to use X-rays. So how would I test you on it? On an X-ray. The palatine bone we've already pointed out. The palatine bone, we said, was this bone right here at the back of the roof of the mouth. And then the temporal bones. Where are the temporal bones? The temporal bones are on the sides of the skull. This is the temporal bone right here in our lab manual in orange. In our Mr. Skullhead picture, the temporal bone is this big bone right here labeled T. Temporal means on the side, the temples. So the first thing is the squamous portion of the temporal bone. It's labeled T1. Now just today, we learned the term squamous. Simple squamous epithelium. And what did that mean? Wow. Squamous meant round and flat. So squamous kind of means flat. So where is the squamous portion of the temporal bone? It's labeled T1, this flat area on the sides of the skull. So this area on the side of the skull is all flat right here. So that's called the squamous portion. So we see how these words just keep reappearing. The next term, external auditory meatus. Some books will call it external acoustic meatus. That's simply this opening right here on the side of the skull where your auditory canal is. Your auditory or ear canal is right here. Now, he doesn't have those weird things that we call ears, outer ears. But if he did, the outer ear would be right around this area here. And this area is called the tympanic portion of the temporal bone. The tympanic portion is this area right around the external auditory meatus, kind of where your outer ear would be. Then the mastoid process of the temporal bone, we wrote it's a hard rounded area right behind your earlobe. So you'd say what? So it's this area right here. This hard rounded area right here is the mastoid process of the temporal bone. It's right below the external auditory meatus. The word mastoid means like a rock. It's hard like a rock. Now, in fact, you can feel your own mastoid process if you find your earlobe and then put your finger below your earlobe, and it's hard right there. That's the mastoid process of the temporal bone. Now, in fact, there's actually a hollow cavity on the inside. So even though it's real hard, it's actually filled with air. And that's known as the mastoid air sinus. Let me speak a little bit about the mastoid air sinus. You'll notice I have a note to see pages E4 and E5. That's what I wrote. See pages E4 and E5 in the lecture outline. So let's take a look at page E4 and then E5. On the bottom of E4, in addition to the 4 paranasal sinuses, there is the mastoid air sinus. It is a hollow cavity within the mastoid process of the temporal bone, and it communicates or connects with the eustachian canals. In this picture, they try to show what a eustachian canal is. Let me try to explain that by looking at page E5. Okay, this is page E5. And right here on the far right is the eustachian canal, also known as the auditory canal or auditory tube. What is the purpose of the eustachian canal or auditory tube? This is a tube that connects between your throat and your middle ear. Now the anatomic or scientific word for throat is pharynx. So it allows air in your throat or pharynx to flow into the middle ear. This tube is called the eustachian tube or auditory tube or eustachian canal. Now this area right here is called your middle ear. Here is the eardrum or tympanic membrane. The eardrum or tympanic membrane. In the middle ear are three little bones. These are the three smallest bones in our body. The name of these three bones are the malleus, the incus, and the stapes. Now the word malleus means hammer, like a mallet. I wrote that right here. Incus is Latin for anvil, and stapes is Latin for stirrup. A stirrup is like what you put your feet into if you're going to ride a horse or have a gynecological exam. Okay, that's called a stirrup or stapes. These three little bones, what is the purpose of these three little bones? When you're hearing sound, the way that we hear sound is sound waves vibrate against this tympanic membrane or eardrum. And as this eardrum vibrates, it causes these three bones to move. And the movement of these three bones amplifies those weak sound vibrations. It amplifies the sound. And then there's this structure here that looks like a snail called the cochlea. The cochlea is the organ for hearing. So if the cochlea is the organ or structure for hearing, it's located in what's called the inner ear. Where these three little bones are, the malleus, incus, and stapes are in the middle ear, and your auditory canal, or external auditory meatus, is the outer ear. So we have the outer ear, the middle ear, and the inner ear. And it's all associated with hearing. So the eardrum or tympanic membrane is part of the outer ear. These three bones are in the middle ear, the purpose of which is to amplify the sound. And then the cochlea is a neurological structure that allows us to actually hear. Incidentally, somebody might be deaf, unable to hear, or have difficulty in hearing if they either have problems in the outer ear, problems in the middle ear, or problems in the inner ear. Any part doesn't work, you have hearing problems. All right, so this middle ear is actually filled with air. How the air gets there is through this eustachian canal. The purpose of air in the middle ear is that in order for us to hear properly, the air pressure in the middle ear has to be the same as the air pressure on the outside of our body. If the air pressure in the middle ear is different from the air pressure on the outside of our body, we won't be able to hear properly. We may experience, you may hear sound as if you're inside of a barrel, or you may hear a popping, you may feel a popping sensation in your ears. That occurs when the air pressure in the middle ear is different than the outer ear. What I just said is written right here. The purpose of the middle ear is to allow equalizing of the air pressure across the tympanic membrane. Now our first thought is, well, why would the air pressure in our middle ear be different than the outside of our body? This is what happens when we get on a plane and the plane takes off. So, in the plane, before it takes off, the air pressure in your middle ear is the same as in the plane. When the plane takes off, there's a change in the cabin pressure, in the air pressure in the cabin of that plane. And that, as the air pressure on the outside of your body becomes different than in your middle ear, it is very common to experience that popping sensation. So what you've got to do to get that popping sensation to go away is you've got to force air from your throat to go up the eustachian canal and re-establish a new air pressure in the middle ear. So whether that involves pinching your nose and blowing up your cheeks, or chewing gum, or yawning, or whatever, you've got to force air from your throat up the eustachian canals into the middle ear to equalize the air pressure so it's the same now as on the outside of your body. The moment you do, that popping sensation goes away. Another clinical aspect to this is what is an earache. An earache is clinically called otitis media. Now, why is it called otitis media? Odo, what does O-T-O mean, odo? Ear. You'd say, well, how would I know that? Page A4. It was one of those prefixes we gave you. Odo is on A4. So odo means ear, itis means an infection or inflammation, and media means middle. Let's put it together. It's a middle ear infection. So an earache is when you have an infection right here in the middle ear. So how the heck did you get a middle ear infection? It's easy. Since the eustachian tube connects from your throat to your middle ear, when you have a sore throat, when you have an infection in your throat, the bacterial or viral infection can spread up the eustachian tubes into the middle ear. So it began with a sore throat, then you might have felt pressure in the eustachian canal, and then your ear, you've got this earache. That's a middle ear infection. So this is very important, this whole area clinically. So we've explained the eustachian canals allow air to flow from the throat into the middle ear. There is that mastoid air sinus that's also part of this whole structure, where it's also filled with air. And we've explained also these three smallest bones in our body, the malleus, incus, and stapes, which are associated for hearing. Back where we were, all of that is related to the mastoid process, and we wrote that. And then the styloid process of the temporal bone. Now the word styloid means like a needle, like a needle. The styloid process of the temporal bone are these pointy projections right here, kind of look like toothpicks, sticking out below the external auditory meatus. Can you make that out? So here, looking at the underside, that's these pointy projections right here. The styloid process of the temporal bone. And what are they for? So we actually wrote that you can see this label T5 on the lateral view of Mr. Skullhead. We also wrote see page E13 in your lecture outline. So let's take a look at page E13. And on E13, here's E13. And you'll notice here, sticking out, here's the external auditory meatus. Here, this thing sticking downwards is the styloid process of the temporal bone. Incidentally, when you answer these names of structures on a lab test, you have to be complete. In other words, you'll notice I wrote styloid process of the temporal bone. Don't just write styloid process. I'll mark it wrong. You'd say, why? As we're going to see, there's a styloid process also on the radius and on the ulna. So a lot of these structures, we use these same names more than one place, and if you just write part of it, I don't know which bone you mean. I know you'll say, you know what I meant. So if I know what you mean, when you turn in the test, just write, you know what I mean, and just turn it in. The problem is I have no idea what you mean. I only can grade you on what you write. So on this page E13, what's the purpose of the styloid process? There is a ligament that connects from the styloid process of the temporal bone to the hyoid bone. Now what the heck is the hyoid bone? The hyoid bone is not even part of your skull. The hyoid bone is this U-shaped bone right here that you can make out. See this U-shaped bone? Now I know it's a little bit hard to make out, so let's find it on you. Put your fingers on the underside of your jaw and swallow. Can you feel something hard moving? It's shaped like a U. That's the hyoid bone. So the hyoid bone is really on the underside of your jaw, your skull, and it is held in place. The hyoid bone is held in place by a ligament connecting it to the styloid process. Now what is attached to the hyoid bone is your larynx and trachea. So you can feel your larynx. You'd say, what's that? Your voice box, your Adam's apple, this bulge right here. And right below that larynx is the rings, the cartilaginous rings of your windpipe or trachea. So your trachea is attached to your larynx is attached to the hyoid bone, and your hyoid bone is held in place by a ligament to the styloid process of the temporal bone. The zygomatic process of the temporal bone. We've talked about that previously. Here on the Mr. Skullhead picture, there is a suture line between the temporal bone and the zygomatic bone. The suture line is right here. This is the zygomatic process of the temporal bone, and Z1 is the temporal process of the zygomatic bone. And on page 6, the mandibular fossa of the temporal bone. We've spoken of this as well. This rounded bump of the mandible is called the condyloid process of the mandible, and it attaches right here into a socket called the mandibular fossa of the temporal bone. And together that forms the TMJ, the Temporo-Mandibular Joint. This is the only movable joint of the skull, and the only bone, if I'm testing you on the skull, the only bone that I might put by itself is the mandible. Now the next two terms, the carotid canal and the jugular foramen. What the red wire represents is this red wire represents the internal carotid artery. The internal carotid artery. And the internal carotid artery is arguably one of the most important blood vessels in the body. It actually goes into the skull through a canal on the inferior side, and this is carrying oxygenated blood to your brain. If there's any reduction in the flow of oxygenated blood to your brain, that results in some part of your brain dying from lack of oxygen, and that's called a stroke. So a stroke is when part of the brain dies because of a reduction in oxygenated blood flow. Now, there's, of course, both a right and a left carotid artery. Here is the carotid canal, right here. Here it is here, here it is here. And so it's like a canal that the artery goes through. And then that's on the inferior side. And then if you look on the inside, the internal side, you can see here's the wire coming in. And this brings oxygenated blood up to the brain. Now, on the inside, this artery is actually kind of running horizontally, like that. And there's actually some connective tissue just covering over it. Then this actual artery comes up through an opening that we'll be learning about called the foramen lacerum. So we'll have more to say about that. Let's take a look at page E17. So on the bottom of E17, here labeled ICA, it stands for internal carotid artery. And this internal carotid artery goes up through this canal, and then it runs horizontally. Can you see where it's going horizontal right here? And then it comes up. So it goes through this canal, runs horizontally for a short distance, and then comes out. It actually, the canal that it enters on the underside of the skull is called the Carotid Canal, and then it comes out through the foramen lacerum. I'll tell you more about that. Okay, so we actually have a right and a left carotid artery that are bringing oxygenated blood up to the brain. Back where we were on our 22-page handout, page 6, then we wrote jugular foramen. And the jugular foramen is a hole through which the internal jugular vein goes through. So if you look on the inferior side of the skull, so you'll see a hole right below, posterior to the carotid canal, is the jugular foramen. Also, if we look on the inside of the skull, so now we're looking at the inside. This big hole right here is called the foramen magnum, the big hole that the spinal cord goes through. Here is the jugular foramen. Here's this vein. And this vein actually kind of wraps itself right in a groove, right here on the side. Can you see there's kind of a groove where this vein fits in? What does it look like on this side? You'll see right in here a groove. Vein is located right in here. It's actually known as the sigmoid sinus. So this is known as the groove for the sigmoid sinus. And then this vein goes right through the jugular foramen, and then it travels, this vein carries blood down the neck. Let's look at a picture that shows this. Let's take a look at page E12. E12. This is page E12. So here is this sigmoid sinus vein. The word sigmoid means shaped like a snake, and it fits in a groove. That sigmoid sinus goes through a hole at the bottom of the skull called the jugular foramen, and then it travels out through that hole and then travels down your neck. And that vein going down your neck is called the internal jugular vein. This is the big vein, and you have a right and a left one, that carry blood from your brain down, back to your heart. Now, most of us are familiar with the jugular vein because we've seen enough vampire movies. Because, you know, the vampires always bite somebody in their neck, and the idea of a vampire is it sucks blood from the jugular. That's called going for the jugular. So why they like the jugular more than the carotid, I don't know. Actually, jugular is more superficial. It's easier to get to, but that's probably why. I haven't really psychoanalyzed all the vampires, but the internal auditory meatus. Where is the internal auditory meatus? Now look, we know that this is the external auditory meatus, right? This opening, this canal on the outside. So there must be some sort of opening or canal on the inside of the skull. On the inside of the skull, the internal auditory meatus is right here. You'll notice it's the opening right above the jugular foramen on the inside. So if you can see the jugular foramen, right above it is the internal auditory meatus. It's a canal. In other words, it's called a meatus, a canal, not a foramen, because the hole does not go through. You could not take a stick and stick it through the external auditory meatus and have it come out through the internal auditory meatus. It doesn't connect. Then the mastoidal fontanelle is one of the soft spots on the fetal skull. So I'll just remind you that in terms of the fetal skull, the mastoidal, we had a sphenoidal fontanelle and a mastoidal fontanelle, and you can see pictures of this on both page, in our lecture outline E3. E3, it showed these fontanelles or soft spots on the fetal skull. And in your lab manual, it says the fetal skull, and you'll notice it has the pictures in color. So all this stuff is here for you. It's got actual photographs of the fetal skull as well. On the page 8, the next thing that's listed are the parietal bones. The parietal bones are real simple. The parietal bones are the two bones at the very top of the skull. The very top of the skull, whether we've got a fetal skull, these are the right and left parietal bones. And the line between the parietal bones is called, the suture line is called the sagittal suture. And you can see the sagittal suture and the right and left parietal bones on both the fetal and an adult skull. Previously, we had talked about most of these suture lines, and the majority of the suture lines are associated with the parietal bones. This is the sagittal suture between the right and left parietal bones. This is the coronal suture between the frontal bone and the parietal bones. This is the lambdoidal suture between the parietal and the occipital bones. On the side of the skull, this is the squamosal suture between the parietal bones and the temporal bone. And I think we've just gone through all the suture lines. The fontanelles, or soft spots, of course, are best seen with the fetal skull. You can't see them on an adult skull. So we've already previously spoken of the anterior frontal fontanelle and a smaller posterior or occipital fontanelle. So everything that I've just pointed to is written on page, the bottom part of page 6 and the top of page 7, which takes us to the occipital bone. The occipital bone is the bone at the back of your skull, and these are all pretty simple. These structures we've asked you to find, pretty simple to find. First, the foramen magnum. Foramen magnum means big hole. So if you look at this big hole at the bottom of the skull, which is in the occipital bone, and of course what passes out through that is the spinal cord, among other things. The occipital condyles. How many times did that word condyle come up? A lot. A condyle, and every time it comes up, I remind you of what it means. Words mean something. A condyle is a rounded part of a bone where it attaches to another bone. So on both sides of the foramen magnum, on both sides of it, there are these rounded bumps right here and here. These are called the occipital condyles. And what they attach to is the very top vertebra of the vertebral column. And that, and because the skull rests on top of, so it kind of sits like this, up here, like this. So the very top vertebra is known, nicknamed either the first cervical vertebra, as we'll be learning, or the atlas. And it's commonly known as the atlas after this character in Greek mythology who was this big giant who carried the world on his shoulders. So similarly, the very top vertebra, or atlas, holds up the skull. So that's what attaches to the occipital condyles. The next thing, external occipital protuberance. What's that? Okay, external, it's on the outside. If you feel the back of your own skull, there is a bump kind of along the midline towards the back side. That's the external occipital protuberance on this skull. It's right here. It's more prominent on some people than others. That's the external occipital protuberance. The next thing that's listed is the internal occipital crest. Now, since it says internal, it's on the inside. It's on the inside. So we're going to open up the skull. We're going to look on the inside of the skull. And here, and let me also remind you, remember anytime we're holding the skull, remember the correct position? The face is on the top, and the back of the skull is on the bottom. All right, that's how it's positioned. You might say, well, why does it have to be that way? Because that's how all your pictures are in the everywhere. It's like asking on any map, the North Pole, the North is on the top and the South is on the bottom. That's the standardized way of projecting a map. So every time you see the skull, the face is on top, the back of the skull is on the bottom. And so this is the foramen magnum. This ridge right here is called the internal occipital crest. And we've seen that term crest before on the anterior tibial crest of the tibial bone. So a lot of these words kind of reappear. The purpose of this crest or ridge is to separate the two hemispheres or two sides of your brain, the right and left. The next thing that's listed are the grooves for the sigmoid sinus. We had pointed out that there's this groove on the inside of the skull. This is the jugular foramen right here, and there's this groove right here where this vein sits right in that groove, and it's on both sides. It's on the other side as well. And this is called the groove for the sigmoid sinus vein. On page E12, here's that sigmoid sinus vein. And it passes right out of the skull, at the bottom of the skull, passing through the jugular foramen. And as this vein travels down the neck, it's called the jugular vein, internal jugular vein. There's a right and a left one.